Wearing a lampshade for entertainment purposes only, it's the Medicare for the Lazy Man podcast. A Medicare podcast no Democrat candidate can plagiarize. Sometimes he wishes he was a sky marshal, Medicare expert Doug Jones.
Hello, ladies and gentlemen. Welcome to another thrill-packed episode of the Medicare for the Lazy Man podcast. First thing I want to do today is congratulate my Canadian nephew, Drew McMillan, on the arrival of his nephew. Doesn't sound confusing at all. Drew's brother, my sister's second son, had baby number 2 for him today, and that baby is Boone Jack McMillan. 8 pounds, 12 ounces. Now, here's the interesting thing about a baby born in Canada. The mother was in labor for 2 hours, and then 4 hours after the baby was born, healthy, everybody was healthy, they booted her right out of the hospital. And she was allowed to take the baby, which is kind of a good thing. But this is what you can expect in Canadian maternal hospitals. The treatment is swift and it's sure. Everybody go home, get out now. I did mention that they're turning the hospitals into motels when I did send a congratulatory message. But thinking back to my mother, I'm the oldest of 5 children. Every one of us was about 4 years apart, roughly. And my mother never spent less than a week in the hospital after having given birth. I don't know that our birthing experiences were any different than what women go through today, but it just seems unusual, or it seems harsh, unusually harsh, or unnecessarily efficient to throw the mother and the baby out of the hospital. The only thing I can remember that even comes close to this is this newborn's father. He was born on Christmas Day, and I think it was because that was the only availability they had, so they induced labor. Now, he's a strapping young man, obviously proud father of 2 healthy kids, and has always been a lot of fun. So I guess the inducement of labor didn't really cause any negative problems for him, but it's pretty weird to see what's going on in Canada. They don't goof around up there. Get out now. Go home. So anyway,
that's great. That's crazy.
It certainly is.
You know what it reminds me of? They're gonna, like the people back in the days of pioneers. They'd be on the trail and they'd jump down off their horse and give birth and get back on the horse and keep on going.
Yeah, or farmers back then. If your wife is working in the fields and her time comes, I guess she just squats right there and calls over another woman to help clean up and then back to work.
You got it. That's exactly right.
Well, in any event, I'd like to be the proud great uncle of these wonderful kids. And I also am proud to be the dispenser of Medicare knowledge, because this is what I do for a living. It is a lot of fun to help people understand that Medicare doesn't have to be confusing, doesn't have to be scary, and it can be a source of excellent health insurance protection at a very reasonable cost, and that is what I do. I explain that to people by virtue of my books. One of my books is the kind of the fleet flagship, and that is entitled Medicare for the Lazy Man 2026. If one were to purchase that book at Amazon.com and have it sent to their home, they'd probably have it in a day or so. And that book would probably cost them around $11 if they wanted the paperback version. It would be less in the Kindle version, less in the Audible version, and much, much more in the hardcover version. But it contains knowledge that will set their minds at ease about Medicare and that will guide them in the direction of the highest quality coverage for the lowest available price. That's always the end result. Now, I've got a couple of other books on Amazon.com. One is Medicare Enrollment Guide. It takes all the important enrollment information and puts it in one spot. And that allows for a very short right to the point book. It's got a bunch of short little chapters. Starts out with your enrollment deadlines and ends up with your enrollment procedures, including that for your Medicare supplement. And then, of course, the final thing would be your Medicare drug plan. And once you have those things under control, you're finished with Medicare, except for your drug plan, which is a perennial problem that has to be addressed every fall to make sure that it's going to be the plan that you would like to have for the following year. But your Medicare coverages and your Medicare supplement plan are yours forever and ever. They are guaranteed renewable for life, and they will not disappoint you. So this is a message I try to convey to listeners and readers of my books. And finally, if you want to do your own Medicare drug plan research, purchase my book, Medicare Drug Plans, a simple DIY guide that will teach you how to use the government website to select the best drug plan for you. It's not that hard to do. What I have is a book with every page being a screenshot from the government website that shows you what to click on and what to enter in their various blanks, their question response areas. And at the end of the procedure, you will not only have identified the best drug plan for you, you will also have been taught how to enroll in that plan. And then, unless the plan comes to an end, you can stay in that plan if you want to. But I suggest that every fall you read every piece of mail that the plan sends out to make sure it's not going to change in unpleasant ways. And also that you consider doing the search again to make sure your plan is the best one for you. And speaking of best ones for you, Randy Carson is maybe the best podcast engineer in the whole wide world. I've always had an excellent experience, and I think today is going to be no different. Randy, tell us how you acquired your expertise, will you?
I bought it. Actually, I got it on the back of a bubblegum wrapper.
Oh, it's nice to know that valuable things are still available.
Well, you remember what was that? What was that bubblegum where there was comic? Bazooka, I think it was. You'd open up the package of bubble gum. It came in one sticks at a time.
Yeah. I never liked Bazooka gum, though. I always liked Double Bubble. And they had a comic strip. Now, Bazooka had Bazooka Joe.
Yeah.
Double Bubble had, I'm not sure there was ever a single character that all of their comics had. But my favorite thing that I always wanted to order was the X-ray specs.
Yes. And I did order those. My dad told me that was not going to work the way they said it was, but I saved up my money, and he said, "Okay, if that's what you want to spend your allowance on, go for it." Just like when I bought one of those little screens you could put in front of your television and make things color.
Yeah.
Neither one of them worked, I'm telling you.
I understand. I was going to buy the X-ray specs, and I had the money, but I thought I should wait until the girls my age got a little more mature. I thought I could put the X-ray specs to better use. And so I waited, and pretty soon it slipped my mind, and I was in college, and I thought, do they even have them anymore?
I don't need I would really like to have a pair of X-ray specs, but apparently they don't make them anymore.
No, and there's a reason for that, too, because they didn't work worth a damn.
So I'm going to, I promised everybody in the last episode that I would tell them a joke about Texas.
And I promised that they would have to chortle, or that they would be chortling uncontrollably.
Chortling is good. So anyway, keep in mind, this is a joke, people. So an old cowboy walks into a bar down in South Texas, and they're all the bar people, the bartender, the people in the bar, and he's got his little dog with him. And they all get up and they say, "My God, boy, that dog is so ugly. What in the world is it?" He goes, "Well, I like my dog." And then so another guy pops up and he goes, "Well, I'll tell you what. Let's have our dogs fight." Now, again, I'm not for dog fighting, but this is a joke, people. So anyway, they say, "Yeah, let's go outside and let's have a dog fight, and the winner takes all, $25. Okay, so they go outside in the street in the dust, and the mud, the blood, and the beer, and the dogs go after it. And this dog, the ugly little one, he just absolutely cleans the clock of this other one. And so the people in the bar goes, "What in the world is that thing?" It just cleaned the clock of this other dog that was like twice or three times his size. And the old cowboy goes, "Well, I don't know what y'all call him here, but back when I got him, before I cut his tail off, he was an alligator."
Oh boy, that's a little on the scary side there, but I guess maybe they don't see a lot of alligators in South Texas. They wouldn't have known. I'm trying to think of some rationale behind this joke, but thank you for sharing it with us.
You know how many years it's been since I told that joke?
I'm thinking a couple.
Couple, 3, 4, maybe even 10.
Oh, there you go. There you go.
And I don't know what popped it into my head other than we were talking about Bob Wire.
But I know that it's been quite a while since our last episode, and you felt the need to share it with us, and that need did not fade away. So thank you for sharing.
No, it kept me up last night.
Oh, well done. Well done. I did want to tell the audience, if you happen to be able to get a hold of today's copy, which is actually March 31st, of the Babylon Bee, the head article in the Babylon Bee is kind of germane to political goings-on that happened over the weekend that we just had. And the headline is, "Here are 11 pickup lines for getting chicks at a No Kings rally." Now, I'm not going to, read those 11 pickup lines, but if you want to, and if you're planning to go to another No Kings rally down the road and you want to pick up a chick, get a hold of the Babylon Bee, and it will list a few surefire pickup lines for you to use. And
I'll get right on that, Doug.
Randy's flummoxed. He said, "Why would I want any of those women?" Is what he said.
I'm not sure I want any of those, but I'll still look at the list because it could be valuable. You don't know.
Yes, it's like a toolkit. You make sure that you've got tools for every occasion if you can.
So I think that would be the pickup line version of a crescent wrench. It fits all sizes.
That's right, and you can use it to defend yourself if you need to. Oh, boy. Well, I'll tell you something right now. After that Texas joke, I'm considering just rolling up the rug and closing down for today. But well done, Randy. Thank you for sharing that with us. We have a daily, or at least a per episode, we always start out with a Medicare Advantage Minute. The Medicare Advantage Minute is designed to showcase an article that has come to light recently, and this article is no exception. It came to me from my client, Robert, who is a lawyer down in Georgia, I believe, and it refers to a subject that we addressed a few episodes ago about Vermont. Vermont had a hellacious time. Medicare Advantage plans have been shrinking all over the country. A lot of people that were in Medicare Advantage plans are taking advantage of this opportunity to get out of Medicare Advantage and return to Medicare and Medicare supplements. You can qualify, even if you're unhealthy, even if you're dying of something, you can qualify in most cases for a Medicare supplement if your Medicare Advantage plan is pulling the rug out from under you. The government says, we'll give you a special enrollment opportunity. And so that is a good thing. I don't think enough people are taking advantage of those opportunities, though. 92% of seniors dropped. This is the headline. 92% of seniors dropped. The Medicare Advantage collapse that is rocking Vermont. Thousands of seniors in Vermont have been shocked by changes to the healthcare system recently. Seemingly overnight, a staggering number of older adults were forced off of their Medicare Advantage plans. This has left many people scrambling to find new coverage. And what's terrifying is that this is setting the tone for a larger trend happening across the United States. Now, as an aside, and just from me personally, that's not terrifying. This is a terrific opportunity to rectify a mistake that you might have made when you first enrolled in Medicare. Going back to the article, if you rely on Medicare Advantage or are considering it, this situation offers a critical warning. Here is what's happening and why it matters and what it could mean for your future Medicare Advantage coverage loss risk. The 92% drop that caught seniors off guard. The numbers coming out of Vermont are almost unbelievable at first glance. Roughly 92% of Medicare Advantage enrollees in the state were forced to leave their plans after insurers exited the market. That means that tens of thousands of seniors suddenly had to find new coverage or switch to traditional Medicare. In some counties, there were no replacement Medicare Advantage plans available at all. At the heart of this crisis is a simple issue: profitability. Insurance companies have been exiting Medicare Advantage markets due to rising medical costs and tighter federal payment rules. When plans become less profitable, the insurers scale back or leave entire regions behind. That's exactly what happened in Vermont, where multiple major insurers withdrew within 2 years. This trend is fueling a growing wave of Medicare Advantage coverage loss across the country. Vermont was hit harder than almost anywhere. While disruptions are happening nationwide, Vermont stands out as an extreme case. Nationally, about 10% of Medicare Advantage enrollees were forced to switch plans in 2026. Vermont, that number skyrocketed to 92%. Making it one of the most severe cases on record. The state's smaller population and rural structure made it less attractive to insurers to remain. Seniors are being forced back to traditional Medicare. With limited or no replacement plans available, many seniors have only one option left. They are being pushed back into traditional Medicare, which I consider to be superior, ladies and gentlemen. Make no mistake, this article is written from the viewpoint of a person who's panicky about it. I say this is a terrific opportunity for these people to return to original Medicare with a Medicare supplement. While traditional Medicare offers broader provider access, it often requires supplemental coverage. That can mean additional costs for Medigap policies and prescription drug plans. Those costs don't have to be excessive, ladies and gentlemen. If you come to Medicare for the Lazy Man, you're going to find out why Medicare supplement costs can be really brought under control. So the next part of this article says what seniors should do right now. If you're currently enrolled in Medicare Advantage, now is the time to review your coverage. Here's what you should do right now. Check your annual notice of change. That's the letter the plan is going to send you probably in September. ANOC, A-N-O-C, annual notice of change. For any plan updates or cancellations, compare options using Medicare.gov, or speak with a SHIP counselor. We talked about SHIP in our last episode because I want to get a SHIP counselor on the horn and have them join us for an episode and find out exactly what SHIP does. Vermont may be the most dramatic example, but it likely won't be the last. Other states have already seen rising disenrollment rates as insurers pull back. Rural and less profitable markets are especially vulnerable to these exits. As healthcare costs rise and policies tighten, insurers may continue scaling back. What happened in Vermont is a clear signal of where Medicare Advantage may be headed. The program still serves millions of seniors, but cracks are starting to show. When insurers leave, seniors are the ones left scrambling to adjust. In today's environment, preparing for possible Medicare Advantage coverage loss is one of the smartest financial moves you can make. And once again, I say there's no reason to panic about this. It's an opportunity. When your plan, if you have a Medicare Advantage plan, when your plan pulls the rug out from under you, the government gives you an opportunity to enroll in the Medicare supplement of your choice, along with original Medicare, of course. You can go to original Medicare and then purchase a Medicare supplement. And if you come to Medicare for the Lazy Man to purchase that supplement, you're going to find that my calculations will prove that a high deductible Medicare supplement is the right way to go. Very inexpensive, very excellent coverage. So last time I touched on an article that is a little lengthy, and I want to probably do some editing as we go through it, but concierge medicine is getting to be more talked about. I wouldn't say more popular because a lot of patients don't like the concept that their doctor has decided to turn himself into a private club that only dues-paying members can patronize. But a doctor who decides to adopt the model of concierge medicine is basically just doing what all entrepreneurs do, trying to figure out how best to sell his skills in a way that he can be successful in the marketplace. So this article says how to respond when clients ask about direct primary care, which is the name they give to concierge medicine. So they refer to direct primary care, DPC, still a relatively small part of the healthcare market, but it's getting more attention lately as healthcare premiums continue to rise. Some consumers are exploring an alternative way to pay for routine care, and direct primary care, or concierge, is one model they may encounter. You probably won't hear about it in most client conversations, but when it does come up, it can be a difficult objection to respond to because direct primary care, or concierge marketing, sits outside the traditional insurance model. This guide isn't meant to train you on DPC or change how you position health insurance. So this is written for agents. This article is written for agents who may encounter a client or a potential client, a prospect, who has a doctor that they're paying concierge, let's say, subscription prices to. So this article is simply meant to prepare you with a clear response if a client brings it up, and to show how short-term health insurance can still play a role in protecting them financially. So what direct primary care is about is many physicians who operate direct primary care practices acknowledge that this openly, what direct primary care does not cover. That should probably go first. Hospitalizations does not cover hospitalizations, emergency room visits, surgeries, specialist procedures, or advanced treatments. Many physicians who operate direct primary care practices acknowledge this openly. They often emphasize that patients still need financial protection against catastrophic medical events. In other words, DPC, direct primary care, handles everyday healthcare, but it does not solve the financial risk of major medical events. Why some consumers are exploring models like direct primary care. Healthcare affordability continues to be one of the most common concerns consumers face with insurance agents. Recent reporting shows rising premiums across multiple parts of the health insurance market, including ACA plans, that's for people under age 65, and employer coverage driven by medical cost inflation, prescription drug costs, and increased utilization. As a result, some consumers are experimenting with models that separate routine care from catastrophic protection, which is one of the reasons direct primary care has gained more visibility. So, this whole article probably is not as germane to our study of Medicare as I had hoped, because it's about short-term health insurance. Now, short-term health insurance is allowed by Republicans and tried to get squashed by Democrats. And when the Republicans are in charge of things, the short-term health insurance plans are more proliferant and more generous. But short-term health insurance, I've always thought of as a bridge to Medicare. If you've got a married couple, one person turns 65 early, and let's say that that's the wage earning person, so they want to go on Medicare, and their spouse, who might be younger, has to have health insurance not provided by the employer, but provided by the family until that person turns 65 and is eligible for Medicare. So the company that I use has several different insurance companies that they suggest for short-term health insurance. And the questions we're dealing with today is concierge doctors. Will health insurance pay for concierge doctors? The answer is no, but this fits in perfectly with my suggestions that people consider high deductible Medicare supplements, because the cost is lower. The additional insurance they have to buy to provide catastrophic coverage is not very costly. And in fact, once they hit 65, they go on to Medicare with a predictable and very, very comprehensive plan that is not going to be all that expensive. So that's my short version of this very lengthy article that I just dropped into my wastebasket. Oh boy, here's one from Tony King. She's a lot of fun, but I'm not sure I have the energy to decipher what she's up to today. And I want to get a little bit of correspondence from people into our podcast. What do we have here? We've got content, and I cannot find the. I wanted to read a short little thing about a woman who kicked me out to the curb, and 4 years ago, and she came back to me and she said, "I'd like you to jump through all these hoops and provide me with some insurance information." And her name seemed familiar, so I went back to my files, my dusty files back in the far reaches of the Medicare for the Lazy Man office. And I saw that I had had dealings with her 4 years prior. And so I said, I think, let's see, I said, my file indicates that I spent a lot of time and effort helping you understand Medicare options, and you then went elsewhere to actually purchase the insurance. I said, I think you should ask that person for guidance. And her response was, that is true. There was an acquaintance from my church who signed my husband up for Medicare and his supplement plan. In the end, she tried to pressure us into getting a more expensive plan. It was not a good feeling. From reading your book twice now, I believed that you were more interested in helping other people than in making money. And I said to her, that is true. And you should also be aware that I get very disappointed when I'm not allowed to help people out. And then I don't have my response to her here, but then I did respond to her factually and offered her the opportunity to continue the relationship. And she went silent on me. So I guess she doesn't like having stress or strife. I wish she had stayed with the program because I would have been happy to help her out. But I wanted her, and I want all people to know that I am not somebody's, what am I not? I'm not somebody's piece of meat.
Patsy. No,
yeah, there
Patsy.
you go. That's a much better way.
You're nobody's Patsy.
That's a much better way to say it. It's almost like I had a weird-looking dog that, maybe there's no connection
he's
there.
short, squatty, ugly dog. That's what he was.
With big teeth.
With big teeth. And long story short is he really, really was not somebody that, any other dog wanted to play with.
But won every fight he ever got in.
Yes.
Probably well fed. So here's another one. This is from a guy named Charles, and he says, "Hey, Doug, I read about your books in the UA, University of Arizona, Alumni Magazine. I've been telling those people for years, hey, plug my books. I don't know why they didn't send me a copy of the magazine that I mentioned in, but anyway, this guy, Charles, said, class of 83 here, and he said, I just turned 65, and I'm still working in a creditable organization, and I did apply for and receive my Part A card. I appreciate the support of the supplement versus Medicare Advantage discussion, and will likely go to high deductible Plan G when it comes time to sign up for Part B of Medicare when I retire later this year. Thanks for clearing this up. It's a murky subject area for me." And I said, "Thank you, Chuck. I will be looking forward to hearing from you in a couple of months, or a couple of months before your retirement date. By the way, a very short written review on Amazon is always appreciated." So I'm hoping that Chuck went ahead and did that. I have no way of knowing because a lot of people on Amazon use pseudonyms. And frankly, I haven't looked lately, so I would like to find out at some point whether there's a more effective way to encourage people to write reviews on Amazon, because that really helps other people decide whether or not to purchase a book and to take it seriously. Let's see here. Well, I could do one more little quiz with Randy. I always like to dangle the possibility of success in front of him and see whether or not it works as a motivating factor. Let us go with the most overweight, obese. Overweight wasn't enough. It had to be overweight, obese cities.
Isn't that the same thing?
You'd think it would be, but apparently obese wasn't fat enough and overweight wasn't fat enough.
Well, then they should have gone the extra mile. There's morbidly obese too.
Well, they didn't go that far. So I guess these are the parameters that you're going to have to use in deciding what your answer is going to be. So we're looking at the 10 most overweight, obese cities in the U.S. Which do you think might be the most overweight and obese city?
Oh, geez. Let's see. New Orleans. I'm going to go with New Orleans.
All right, you know something? You were so right on last time. It's Little Rock, Arkansas.
Oh, it's not New Orleans?
No, but last episode you chose Arkansas for some other category.
Yes, I did. So obviously Little Rock is not Little Rock anymore. It should be Big Rock.
Yeah, big, obese rock. And number 2, McAllen, Texas. Now that's down in Big Bend country, isn't it? Or actually farther south.
Yeah, I think it's further south. Now, why would they be down there?
Well, I'm thinking Mexican food must tend to pork you up.
Yeah, that's probably true. Probably true. All right. And who's number 3?
Memphis.
Memphis.
Yeah. Now we know that's not a hotbed of Mexican cuisine.
No, it's not.
But Elvis was no lightweight by the time he expired.
Well, he lived on peanut butter and banana sandwiches. So
I think that's when he had actually action. He was on stage a lot and did a lot of activity. I think he porked up towards the end of his life. So I'm not sure.
Have you ever had one?
No, I have a lot of peanut butter in my life. No bananas with the peanut butter.
Try it. I think you'll like it.
It sounds like I should throw up. Excuse me for a minute. Okay. Number 4, Jackson, Mississippi. And then going on down the list, Augusta, Georgia, Lafayette, Louisiana, Fayetteville, Arkansas. We're back to Arkansas again. Shreveport, Louisiana, Mobile, Alabama, and Baton Rouge.
Baton Rouge.
Yeah.
You know, there's a commonality here, Doug. There's a commonality.
Would you share that commonality with us?
It seems as though there's a lot of southern eastern states in this. Southern central.
Right-leaning.
Right-leaning, yeah. I don't know. There's probably other similarities, but that's the one that comes to the top of mind.
All right. Well, let's go to the other end of the spectrum here and talk about the cities with the lowest rates of overweight and obesity. They couldn't use one or the other. Once again, it's got to be both overweight and obese. Number 1 on the list of the skinniest, let's call them the skinniest skinniest people.
Skinniest people in the United States. Let me see here. I'm going to go for, okay. Here's the obvious one, Florida.
Same general type of weather, but far, far away, about as far away as you can get in the United States.
California.
Hawaii.
Hawaii.
Honolulu apparently is full of the skinniest people in America.
Well, that's because they live on Spam.
Well, yeah, and plus a lot of them are Asians too.
Yeah.
I don't think
I think an Asian person can eat until their head caves in and they won't gain an ounce. That's a good thing. I don't know why that is, but
well, there was a character on the old Hawaii Five-0 series named Wo Fat.
Yeah.
And he was kind of a tubby guy, but he was the only one. He might not even have been an Oriental. He might have been an Occidental, pretending like Charlie Chan.
Yeah.
It was Sidney Toller or Tolliver, Sidney Toller. He was not Oriental at all. Anyway, so that was number 1. Skinniest people in the United States are in Honolulu. If you want to travel more domestically to see a lot of skinny people, number 2 is Denver.
Well, they spend most of their life, running up and down mountains.
Yeah, that would account for it. Number 3, Seattle. Colorado Springs is here as a number 4 of skinniest people. San Jose, California. I went to the airport once and kicked the content curator out of the car, the Corvette, and took off again. I didn't really check out the skinniness of the patrons or the residents. Oh, boy. Here comes the 6th skinniest in the U.S. 6th skinniest. Boston. Yeah, that's close enough to the top for me.
I should have gone with, so are we going with states or cities?
Boston is a city. No, this whole list is cities.
Okay, sorry. I thought we were going states again. I would have said it otherwise. Massachusetts, but you threw me.
Yeah, I'm so sorry. It's got to be my fault, and I apologize. Okay, so Boston number 6, number 7, San Francisco, number 8. Uh-oh, how can you tell under the parkas? Minneapolis,
So we're going for the skinniest?
skinniest. These are the skinniest cities, the top 10 skinniest. Salt Lake City, and then Portland, Oregon rounds out the list of 10 skinniest cities. There are 10 cities
Oh,
with the skinniest people. I should read the evaluations here. They use 19 metrics ranging from the share of physically inactive adults to healthy food access. So does that mean within reach of your easy chair? Each metric was graded on a 100-point scale, with 100 representing the most overweight and obese, and each metropolitan area's overall score was then based on a weighted average. I think that's where they tilt the scales, the weighting of the average. So I think they're probably, they're inserting their editorial opinions into
as
those
soon as they
results.
start talking weighted average, then they can influence that ranking any
Yeah,
way they want.
absolutely, and I'm pretty sure that that's what they're up to. So anyway,
So we should call the skinniest people in the United States. We should call that the March of the Wagobies.
yeah, okay. I was just trying to think of how I can use a weighted average to predict the success of future podcast episodes.
The
Medicare for the lazy
GL1,
man.
the GL1 people.
Yeah, there you go. Well, we found out that when they stop taking GLP-1, it's not a sentence to adding more weight. Some people do actually continue to lose weight.
Well, that's probably a good thing. Probably good. But I've also seen some people, we won't name any names, that are heavily into the glutides,
Yes, yeah.
and they look like Skeletor. You remember Skeletor? He was in a comic.
Well, I remember Skeletor because my kid was a Skeletor of age, of the proper age to enjoy Skeletor.
Yeah, okay. Well, then there's a lot of people that have gotten to way too far into the glutides, and they should all be wearing Skeletor t-shirts.
Well, so far it's rare that I see anybody that's too skinny. There's a lot of meat on the hoof, and I would prefer a more balanced approach to weight control. I don't know. I'm trying to be
I
diplomatic.
I'm
How
pretty
am I
sure
doing?
you're from Oklahoma. Too much meat.
There you go. And,
It's
yeah,
true. It's absolutely
in
true.
both respects, in Oklahoma, there's a lot of meat on the hoof there. In any
Oh
event,
dear.
I think you should tell me to shut up and take us on out of here. What
We
do you think?
need to close up shop because, you know what happens if we last too long. I start having to dip into the emergency quarter reserves.
Yeah, that never works out in our favor.
So here we go. Grab your pencil, folks. DBJ at mlmmailbag.com. That is where you can reach out and talk to Doug, ask for, resolution to your problems, marriage advice, anything you want.
Yeah, yeah. Spiritual.
Spiritual advice,
Yeah.
DBJ at mlmmailbag.com. Doug is licensed in every state of the union to help you with your Medicare supplement planning. Medicareforthelazyman.com. That's on the website. That's everything on the website. That's where it's happening on the web. We would appreciate it in your wanderings through the wilds of the internet. Leave some reviews for us. We're still trying to, well, we are not just trying, we are staying ahead of the Travelog people pretty handsomely, I would say. Thank you for joining us today. You could have been anywhere else, doing anything else, with anybody else, and you weren't. You were with us, which is exactly where we like to have you. Medicare for the Lazy Man podcast. And you've just spent about 32 and a half minutes with Doug Jones, the anti-insurance insurance guy, originally from Oklahoma. Not now. He's living in the high ground behind Cave Creek, Arizona, in the Nosebleed Mountains, home of the Nosebleed Indians. And I checked today before we got on the horn here. Doug, the studio at his establishment is higher than mine, but his is really high today. He is up at the 16,500 foot level.
I always thought I'd go through life being high as a kite, and it turns out this is the way I'm doing it. Not as much fun as I predicted, but in any event, thank you so much for joining us again, and it's hopefully enjoyable and instructive when you come by the Medicare for the Lazy Man podcast. We'll be looking forward to having you join us again in our next episode. Until then, bye-bye.